So hello friends, now we are back with another video about the cervical spine anatomy, that is X-ray anatomy, AP and lateral view. So first we will go with the lateral view of the cervical spine. So this is the lateral view of the cervical spine. As you can see here, the vertebral bodies C1 to C7 are seen in this film, this radiograph. The C1 and C2 is also known as atlas and axis vertebra, and posterior arch and anterior arch of the atlas is seen in the X-ray clearly, as you can see here. Then the second vertebra is also known as axis, and the process of the axis vertebra is known as odontoid process. So C1 articulates with the C2 vertebra with this odontoid process, and it is also known as the dens of the axis vertebra, that is the C2 vertebra. So here is the dens as depicted in this image. Then let's come to the intervertebral disc spaces. So intervertebral disc spaces are the spaces between the vertebra spine. Then next comes are the superior and inferior end plates of the cervical vertebra, as you can see here, which are very important while reporting of the cervical spine X-ray. Then next comes spinous processes of the cervical vertebra. The posterior elongated bones behind each cervical vertebra are the spinous processes. Then comes the pedicle and lamina of the cervical vertebra, as you can see here. Okay. Then superior and inferior articular processes are seen in this image. So the joint between the superior and inferior articular process is known as the facet joint. Okay, so that was the very brief information about the lateral view of the cervical spine. Hope you have liked it. So any changes of the cervical spondylosis are best seen in a lateral view, as this image you can see here, as lateral view, and this image you can see here are the reduced disc spaces, straightening of the spine, end plate sclerosis, and the peridiscal osteophytes.